Drug safety in the treatment of anxiety syndrome is a critical aspect of managing this common mental health condition. Anxiety disorders affect millions of people worldwide, causing significant distress and impairment in daily functioning. While therapy and lifestyle changes can be effective in managing anxiety, medications are often prescribed to help alleviate symptoms. There are several classes of medications commonly used to treat anxiety, including selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, benzodiazepines, and beta blockers. Each class of medication works in a different way to help reduce anxiety symptoms, but they all come with potential risks and side effects that must be carefully considered. SSRIs and SNRIs are often considered first-line treatments for anxiety disorders due to their effectiveness and relatively low risk of side effects. These medications work by increasing the levels of serotonin and norepinephrine in the brain, which can help regulate mood and reduce anxiety. Common SSRIs include medications like Prozac, Zoloft, and Lexapro, while SNRIs include drugs like Cymbalta and Effexor. While SSRIs and SNRIs are generally well tolerated, they can cause side effects such as nausea, insomnia, and sexual dysfunction. In some cases, these medications can also increase the risk of suicidal thoughts, especially in young adults. It is important for patients to be closely monitored by their healthcare provider when starting these medications to ensure that they are safe and effective. Benzodiazepines are another class of medications commonly used to treat anxiety disorders, but they are typically reserved for short-term use due to their potential for abuse and dependence. Benzodiazepines work by enhancing the effects of a neurotransmitter called gamma-aminobutyric acid, GABA, which helps calm the brain and reduce anxiety. Common benzodiazepines include Xanax, Ativan, and Valium. While benzodiazepines can be effective in quickly reducing anxiety symptoms, they can also cause drowsiness, confusion, and memory problems. Long-term use of these medications can lead to tolerance, dependence, and withdrawal symptoms when stopping the medication. It is important for patients to use benzodiazepines only as prescribed and to work closely with their healthcare provider to monitor for any potential side effects. Beta blockers are another class of medications that can be used to treat the physical symptoms of anxiety, such as rapid heart rate and trembling. These medications work by blocking the effects of adrenaline on the heart and blood vessels, which can help reduce the physical symptoms of anxiety. Common beta blockers include medications like propranolol and metoprolol. While beta blockers are generally well tolerated, they can cause side effects such as fatigue, dizziness, and low blood pressure. These medications are typically used on an as-needed basis to help manage specific symptoms of anxiety rather than as a long-term treatment. It is important for patients to work closely with their healthcare provider to determine the appropriate dose and frequency of beta blockers to ensure they are safe and effective. In conclusion, drug safety in the treatment of anxiety syndrome is a complex and important consideration for healthcare providers and patients alike. While medications can be effective in managing anxiety symptoms, they also come with potential risks and side effects that must be carefully weighed. By working closely with a healthcare provider and monitoring for any potential side effects, patients can safely and effectively manage their anxiety symptoms and improve their quality of life.